Pressure ulcers, also known as bed sores or decubitus ulcers. Pressure ulcers are caused by prolonged pressure to one area of the skin. A pressure ulcer is usually found in a patient that has become immobile and lays or sits in one position for long periods of time. When a patient's skin is pinched between bone and another surface, which is often a bed, the blood vessels in the dermis become constricted and the blood flow to the epidermis is cut off. This eventually leads to the death of the tissue that is affected. Pressure ulcers are commonly found in pressure points in the body where the bone and the skin are right up against each other. Most common areas for pressure ulcers are the elbows, the heels, and the tailbone. Other common areas might be shoulder blades, the hip, the shoulder, the ankle, the ear, and the buttocks. The first stage of a pressure ulcer usually involves the epidermis. The epidermis usually will show signs of irritation, so it'll appear to be red, swollen. It can also be itchy. During stage 2, the ulcer reaches the dermis. The tissue in the epidermis has begun to die, and it is now an open wound. Blisters can form. It can also start to produce pus. However, the pressure ulcer will not bleed because the ulcer has been caused by a cutoff of the blood supply. Stage 3 of the pressure ulcer extends down past the dermis into the hypodermis. This stage causes patients to be at an increased risk of infection, and it's a more difficult stage to treat. As you can see here, the hypodermis is now exposed. During stage 4, this is the most serious stage for a pressure ulcer. The death of tissue has now extended down past the hypodermis into the underlying muscle tissue and even into the bone tissue. This puts patients at a really high risk of developing infections, and even at this point, the ulcer still won't bleed though, because again, the wound and the death of the tissue has been caused by the cutoff of blood supply. Pressure ulcers are easily preventable. Moving patients every 2 hours to relieve pressure points is typically practiced by most caretakers or healthcare professionals in order to prevent them from developing in the first place. If pressure ulcers do occur, treatment for early stages like stage 1 and 2 usually include moving the patient every 20 minutes or so to relieve pressure. It also might include putting a patient on an air mattress so that the areas can breathe, or massaging the affected areas to increase blood flow. More serious cases of pressure ulcers, like stage 3 and 4, will probably need to have the dead tissue or infected tissue removed. Antibiotics and packing of the wound might be necessary as well.